Hi folks, this is Marik here. A number of the cool beans had asked me to do a very basic talk on COVID-19. So this is, today we're going to talk about back to basics. I have no disclosures and no conflicts of interest to declare. So we're going to talk about infections today and disease pathogens. And it's important to recognize that there are generally four groups of pathogens: viruses, bacteria, protozoans, and fungi. The most important being viruses and bacteria. So the pathogen, depending on its virulence, interacts with a susceptible host and a favorable environment. And depending on the outcome of this interaction, you may have asymptomatic infection, mild disease, or a severe and fatal disease. We're going to review the structure of bacteria. So this is a bacteria such as E. coli. You can see there's a central DNA, and then there are ribosomes. Ribosomes are little structures in the cytoplasm which allow for protein synthesis. Then the bacteria has a plasma membrane, which is very similar to the plasma membrane of human cells. This is then surrounded by a cell wall and a capsule. This is important as humans and mammals do not have cell walls. The cell wall structure is very particular to the bacteria. And this is the site where many antibiotics work, including penicillins. So penicillins act on the cell wall. There are other antibiotics that act on the ribosomes. This is a virus. As you can see, it's a very simple structure. It has a genome, which may be made up of DNA or RNA. It has an envelope, and it has a surface protein and a few proteins within the virus. Please note there's no cell wall and there's no ribosomes. So antibiotics do not work on viruses. And this is really important because patients who have the common cold, which is a viral infection, or influenza, again a viral infection, are commonly treated with antibiotics. Antibiotics do not work on viruses. For some viruses, such as hepatitis C and HIV, there are specific antiviral agents that work on unique pathways specific to that virus. For COVID-19, the most commonly used antiviral is remdesivir. This is a non-specific antiviral that targets the viral RNA. It's a non-specific antiviral agent. So contrasting the difference between a virus and a bacteria, these are the key differences. Viruses are not living organisms. Bacteria are living organisms. Viruses only grow and reproduce inside of the host cells they infect. When found outside of these living cells, viruses are dormant. Therefore, their life requires the hijacking of the biochemical activities of a living cell. In contrast, bacteria are living organisms that consist of a single cell that can generate energy, make its own food, move, and reproduce, usually by binary fission. That means just splitting itself. This allows bacteria to live in many places: soil, water, plants, and the human body, and may serve many purposes. Viruses are submicroscopic. They are tiny. Bacteria are giant compared to viruses. A viral infection is usually systemic. Viruses infect a host cell and then multiply by the thousands, leaving the host cell and infecting other cells of the body. Bacterial infections, on the other hand, are usually confined to a specific part of the body, described as a localized infection. Infections may be caused by the bacteria or by the toxins it produces. Diseases caused by viruses include influenza, measles, polio, AIDS, and COVID-19. Bacterial diseases include most commonly pneumonia, urinary infection, but also tuberculosis, tetanus, and food poisoning. Again, a major difference between bacteria and viruses is that bacteria are killed by antibiotics, which usually target the cell wall or the ribosome. Viruses are unaffected by antibiotics. So what is coronavirus and COVID-19? Coronaviruses are a large family of viruses. These are RNA viruses. They cause infection ranging from the common cold to severe acute respiratory syndrome, SARS. Sometimes new variants of coronavirus emerge, such as SARS-CoV-2, which causes COVID-19. SARS-CoV-2 has the potential to spread widely, as lack of immunity means everyone in the population is susceptible. So the bottom left is a schematic of the virus with these crowns, which is where the corona comes from. On the surface, these crowns are the spike protein, which are embedded in the cell membrane. In addition, the virus has E proteins, a membrane protein, an envelope, and the RNA genome. So these structures are important when it comes to specific tests. As we'll see, the molecular tests are directed against the RNA genome, whereas the antigen tests are directed against some of these proteins. It's important to emphasize again, this is not the flu. This is the death rate in age, by age in the US, and you can see for every single age group, the death from COVID is significantly greater than that for influenza. Secondly, as we know, the disease is completely different to the flu. While it may start off looking like the flu, the outcome is significantly different. So how severe is COVID-19? Many people have no obvious symptoms. About 20 to 40% of people infected with the virus are asymptomatic. They don't have symptoms. However, these patients are infectious, which is really important because this is probably how the virus spreads so rapidly. Of those with symptoms, 80% are mild. More severe disease occurs in older people, diabetics, patients with heart disease, patients with chronic respiratory disease, and most importantly, obesity. About 1% of infections are fatal, and these are usually in the high-risk group. However, this doesn't mean that patients who do not fit this category don't die. We know recently a 28-year-old healthy physician died from COVID. So this is a ruthless disease and no one is spared. On the right you can see the pyramid of mild, severe, and critical illness. So how does SARS-CoV-2 spread? As we discussed before, probably the most important route of transmission is droplet spread. So these are larger particles that travel less than 6 feet. There is some evidence of aerosol spread, so these are smaller particles which travel further. As we'll see, fomites is probably an uncommon, if not very rare way of transmitting this disease. So as we said, droplets are large particles, travel about 6 feet. Airborne, these are smaller particles which travel further. It's likely that both mechanisms are responsible for transmission, but it appears droplet spread may be more important. In terms of transmission by surface contact, this is very, very uncommon. It is possible that a person can get COVID-19 by touching a surface, such as a table, a doorknob, a phone, a toy, that has the virus on it, and then touching their mouth, nose, or possibly their eyes. But this appears in real life to be a very uncommon way to spread the infection. So in experimental models, you can grow the virus for a number of hours or days, but in real life practice, this appears a very, very uncommon way of spreading the virus. So how does this cause disease? So what happens is, as we said, you have droplets spread, you inhale the virus, which then replicates in the nasopharynx. The cells of the nasopharynx, your nasal passages, have receptors for this virus, and this virus replicates thousands and thousands and thousands of times, resulting in an exceedingly high concentration, millions and trillions of virus in the nasopharynx. What then happens in some people is you have a very high viral load. Some of these viruses then get aspirated into the lower respiratory tract. So the best way of controlling this pandemic is to control droplet spread. And the most effective way of doing this is face masks. There's absolutely no question of doubt that face masks are the most effective way of controlling this pandemic. And as the slide indicates, they protect both the wearer as well as the people in contact with that person. And what it does is it reduces the inoculum size of the wearer, and inoculum size is an important factor determining outcome. So the wearer is much more likely to have a mild or asymptomatic infection. As you can see in the graph at the bottom, face coverings are the most effective way of controlling this disease. So what do we mean by sustained community transmission? This means that COVID-19 is affecting many people in the community, and they may not all have had obvious contact with someone who has symptoms of the infection. During this period of sustained community transmission, infection control precautions will need to be taken with all residents, not just those with symptoms of COVID-19. So this means in a community with a high rate of transmission, every single resident needs to wear a mask. And indeed, I think if the whole nation just adopted mask wearing, this would have a dramatic effect on the control of this disease. So what can you do? What's within your control? Wash your hands. Most importantly, wear a mask when in contact with others. At the beginning, it may be a bit awkward, but with time, people get used to wearing a mask. It's just like a piece of clothing. You wouldn't want to go out naked, so you want to wear a mask. Cover your cough. Establish social distancing. Limit attendance at large gatherings. Stand about 6 feet away from other people. Limit your contact with those who are ill. You need to determine your risk assessment, because this will determine your behavior. And the higher your risk assessment, the more stringent you need to be. And most importantly, don't go to work or school or gatherings when you are infected. What are the symptoms of COVID-19? So how do you know when you have the disease? As we said, 20 to 40% of people are asymptomatic. They have no symptoms. However, 80% will have symptoms. Symptoms start between 1 and 14 days after exposure. The duration probably depends upon the inoculum size, i.e. how much viral load was inhaled, as well as the immune status of the host. However, the mean incubation period is about 5 days. Initially, it's a disease similar to flu, but that's where the similarity ends. However, this is important as we go into the flu season, because initially, based on symptoms, it is impossible to distinguish flu from COVID-19. It's obviously important to know what the patient has, and that's why testing is just so important. Most people have fever and dry cough. What's unique about COVID is the acute loss of taste and smell. This seems to be a very characteristic feature of COVID-19, and it seems to be related to the very aggressive replication of the virus in the nasopharynx, which affects the olfactory bulbs involved in the smell pathway. What's also important to note is elderly people may present with different features. Confusion, lethargy, decreased alertness and mobility, and diarrhea are common presenting features in the elderly. These people may not have fever, so one must be alert that a change in the mental status of an elderly person may indicate infection with COVID-19. Most people have symptoms for about 5 to 6 days, which then resolve. Unfortunately, though, many patients may develop the post-COVID syndrome, which we'll discuss. However, about 20% of patients will develop more severe illness, usually from about day 7, as we'll see, with shortness of breath, lung inflammation, pneumonia. So on the right are the common symptoms of COVID: fever, dry cough, loss of taste and smell, fatigue, production of sputum, shortness of breath, muscle and joint pain, sore throat, headache, hoarseness, nasal discharge. Out of these symptoms, as we've said before, the top 4 are the most common: fever, dry cough, loss of taste and smell, and fatigue. So, if you have these symptoms, what do you do next? So, fever, cough, shortness of breath. These are the progression of COVID-19. So, as I said, what do you do when you present with fever and you think you have COVID? We'll come to that. What you need to do is testing. So these are the stages of the syndrome. So it's important to recognize that this disease progresses through a number of stages. There's the incubation phase, which we said about 5 days, the symptomatic phase, which lasts for about 6 days. Note that the virus replicates during the incubation and symptomatic phase. Once the patients enter the pulmonary phase, they no longer have live virus, and the pulmonary phase is due to the viral debris. Because of the rapid replication of the virus in the nasopharynx and lung, one is left with a viral graveyard with gazillion pieces of viral particles to which the host responds. There's a profound immune response to the viral debris. But it's important to note these are not live viruses. These are pieces of dead virus. And again, the symptoms during the symptomatic phase: fever, malaise, cough, headache, diarrhea. In the pulmonary phase, patients develop lung involvement with hypoxia, which is decreased concentration of oxygen in the arterial blood, which we'll come to, as well as shortness of breath. One of the unique features of COVID is patients may have quite significant hypoxemia, i.e. they have low content of oxygen in the blood, yet do not have shortness of breath. This is why pulse oximetry is so important, and we'll talk about it in the symptomatic phase. As the disease progresses, patients get more pulmonary involvement with severe and progressive hypoxemia. So looking at the viral load. So in blue is SARS, in green is MERS, and in red is SARS, the original SARS. Blue is SARS-CoV-2. So what you'll notice is that the viral load of SARS-CoV-2 is highest before the onset of symptoms. This is really important. That's why it's the asymptomatic patient and the patients in the pre-symptomatic phase that are such effective spreaders of this virus. And you can see compared to SARS, the viral load is significantly less. So patients with SARS-CoV-2 have a very high viral load, and unlike SARS, in which the viral load increases after onset of symptoms, with SARS-CoV-2 it's highest before the onset of symptoms. And this is why this is such an infectious disease. So again, here are the stages of the syndrome. Here, day 1 is the day of symptoms. The top panel is patients who live. The hatched below it is those who die. Fever lasts about 12 days, cough about 19 days, As you can see, as we said before, people have symptoms, flu-like illness lasts about 5 to 6 days, and then they develop the pulmonary phase. And this is when they aspirate the virus, they have this inflammatory response in the lung. Dyspnea means shortness of breath. Usually starts on day 6. A few days later, they go to the ICU, put on a ventilator, and die. And clearly what we want to do is control or prevent this cascade of events. Testing. We spoke about testing. So testing is really important. So if you have symptoms of COVID, you need to be tested. You need to be tested because if you're positive, you need to be quarantined, and there needs to be contact tracing so we can control this disease. So if you have signs and symptoms of COVID-19, cough, fever, respiratory symptoms, shortness of breath, you need to be tested. And obviously it's important to distinguish between COVID-19 and influenza because the management is different. The other people who need to be tested is if you've had direct contact with a person who's been diagnosed with COVID-19. Because again, if you are infected with the virus, you need to be quarantined, as well as other therapy we'll talk about. So it's really important to be tested. Testing is critical both for the patient and for controlling this disease. However, it is important to call your doctor, ER, public health department before you seek medical care so that appropriate precautions can be taken prior to your arrival. And of course, in transit, you want to wear a mask. So there are different tests which are confusing to people, and we'll go through the different tests. This is from the FDA. There's the molecular test, the antigen test, and the antibody test. So the molecular test basically looks for or targets the viral RNA. So the most common test is the PCR test, which is directed against oligonucleotides in the viral RNA. The antigen test targets, these are usually antibody tests, a protein which is specific to the virus. So this could be the spike protein or the N protein. They're both samples are nasal or throat swabs. In terms of how long it takes, the molecular test should take less than a day. It should never take up to a week. It kind of defeats the whole point of the exercise if it takes a week to get the result. The antigen tests or rapid tests, really within an hour. Do you need another test? If the PCR is positive, means that you have the disease and you really don't need other testing. In terms of the antigen test, positive tests are highly accurate, means you have the disease. If they're negative and there's a high index of suspicion, you may need to do the molecular test. What do both tests show? Both tests diagnose active coronavirus infection. However, as we've said before, the fact that you have the antigen or you have RNA does not mean that the virus is alive. All it means is that you've been exposed and you've had an infection with the virus. It doesn't mean you have active viral replication. But usually these tests are to diagnose whether you've had COVID. The antibody test, this is a serological test, so it looks for antibodies in the blood. So when the body is exposed to an antigen, and antigens are proteins, so if you're exposed to a viral protein, the body mounts an immune response and you develop antibodies specific for that antigen. These are usually finger sticks or blood draws. In terms of how long it takes the results, usually the same day. And all it means is that you have at some point been infected with the coronavirus. And as we'll see, it takes about 2 weeks to develop antibodies. So these tests are often used for hindsight diagnosis. So this is an example of a PCR test. This is a novel lab-free point-of-care test for SARS-CoV-2. So the technology is rapidly developing with the pressure that we under. Quite remarkably, these new tests are being developed. This is a truly remarkable point-of-care PCR test. It's a tiny little machine, and you can see within 60 to 90 minutes, you can get a result. So there is really no reason that patients and folks out there need to wait a week to get a test result. We have the technology available today, and these kind of tests should be widespread and readily available. What about the antigen tests? They have a lower sensitivity compared to the PCR, but they are specific for the virus. They're approved for the FDA for symptomatic patients within 5 to 7 days of onset of symptoms. Rapid antigen tests may need to be confirmed with a PCR if the result is inconsistent. And negative tests sometimes require, again, a PCR. This is the Abbott antigen test. It's truly remarkable. It's on a simple card, much like a pregnancy test. It's an antigen test. It takes 15 minutes, costs $5. So there is no reason that these tests should not be widespread. And these less sensitive tests are actually okay for screening and for most clinical situations because they will be positive with a high viral load. The high sensitivity PCR becomes more important in hospitalized patients and in patients who have negative antigen tests. So this is an important slide, the time course of live virus and laboratory tests. As we've said before, one gets exposed to the virus, it replicates during the incubation period. The highest viral load is just before onset of symptoms. Then with time, the viral load decreases, presumably due to the host's innate immune response, such that by day 8 of symptoms, there's no longer live replicating virus. It's really important. The period of that a patient or person is infectious, you can see it starts a few days before symptoms and up to about 5 days after onset of symptoms. However, you can see that the nasopharyngeal PCR test remains positive for a prolonged period of time, at least 3 weeks. So patients can be PCR positive, i.e. they have RNA, but they do not have active replicating virus. This is an important concept to understand. The PCR means that you have been exposed to the virus. It does not mean the virus is actively replicating. And then we can see antibodies. So this virus is somewhat unique in that IgG and IgM antibodies develop at the same time. You can see that once the virus has stopped replicating, we develop an antibody response, probably indicates the development of cell-mediated or adaptive immunity, and that after about 2 weeks, we develop antibodies, maximum at about the end of the 2nd week of symptoms. So this is our management protocol for COVID. I'm going to talk about prophylaxis in patients who are symptomatic at home. It's important to realize that there is no specific treatment for COVID. The only drug which has been proven unambiguously to work are corticosteroids, but they are used in the pulmonary phase. Again, important to emphasize, corticosteroids are used in the pulmonary phase, not in the symptomatic phase. So in terms of prophylaxis, these are the drugs we recommend. This is based on preclinical data, laboratory data, and common sense. The first dictum in medicine is first do no harm. So these drugs are safe and they may be very useful in mitigating against this disease. So we recommend vitamin C, 500 milligrams, BID is twice a day, and quercetin 250 daily. We've reduced the dose somewhat because we've noted that patients who take 500 or more a day may develop hypothyroidism. This is a very rare complication, but it has been reported. Furthermore, patients who are taking thyroxine because of hypothyroidism should be somewhat cautious using quercetin, and if they do, they should probably speak with their practitioner who should measure their TSH levels. In addition, we have zinc, melatonin. It's important to recognize that melatonin was recognized in a large study as a drug which reduces the risk of developing COVID. So we do have some good data on melatonin. Vitamin D, and we'll speak more about vitamin D. We recommend a dose of 1 to 3,000. Famotidine is an anti-ulcer drug, an antacid drug, which has been shown to decrease the death or mortality in patients hospitalized with COVID-19. It has a number of mechanisms of action as antihistamine and does have some antiviral properties. So that's our approach to prophylaxis. And obviously trying to avoid exposure to people infected and wearing a mask. So what happens if you test positive and you're in the symptomatic phase and you're treated at home? So again, vitamin C, 500 twice a day. We recommend this time a higher dose of quercetin just because it's for a short period of time. Zinc, we increase the dose of melatonin. Optimal dose is not known. Vitamin D3, again, we increase the dose slightly, and we'll talk about that. Aspirin, unless you have a contraindication, usually a bleeding tendency or bleeding ulcers. The reason we include this is that COVID-19 causes a prothrombotic or clotting state, and aspirin has anti-clotting properties by interfering with platelet aggregation. So we recommend aspirin. And then again, famotidine. In symptomatic patients, as we've said, we recommend home pulse oximetry. This is because patients can have lung involvement and not be short of breath. So one needs to pick this up early. So you may know that President Trump has been admitted to Walter Reed Medical Center for COVID. It's interesting to note that Trump's doctor said he is taking zinc, vitamin D, famotidine, melatonin, and aspirin. Wow, we wonder where he got that idea from. This is a pulse oximeter. It's a little device that fits on the finger. These devices are quite cheap, less than $50. Some of them are $20 to $30, available at most big supermarkets and on the internet. So what it does is it measures the amount of oxygen which is bound to hemoglobin. So the amount of oxygen which is carried in the blood. This is reflected by the saturation. You can see this patient's saturation is 93 and his pulse is 73. Now, what is more important than an absolute value or spot value is the trend. So we recommend that it be measured a few times a day. Patients should be sitting. So we have a sitting pulse ox as well as a ambulating or walking pulse ox. And if either of them falls, I think that's an indication of lung disease. You need to contact your physician or go to hospital. We now need to talk about vitamin D because, as you'll see, it's a very important way of mitigating against COVID. But there have been lots of misinformation in regards to the dosing. We need to know that the recommended daily allowance for adults, regardless of age, is 800 to 1,000 units a day. We used to think that the safe upper limit was 4,000 units a day. However, there are a number of authorities that have challenged this in certain groups. So that means that we really do not recommend taking 4,000 or more units per day. So this is an important slide. on the bottom axis, the x-axis is the 25-hydroxy vitamin D or vitamin D level. The y-axis is the positivity rate for SARS-CoV-2. So that you can see as the vitamin D level falls below 30, and 30 usually is the threshold which distinguishes vitamin D sufficiency from insufficiency. 20 is the threshold for insufficiency or deficiency. So as your vitamin D level falls, your risk of developing COVID-19 goes up significantly, particularly for a level less than 30. This is a recent study which looked at the risk of death in patients with COVID-19 across a number of age groups, and you can see again the threshold of 30 markedly divided patients with COVID-19 who died. So as you can see, there are some patients who had higher vitamin D levels who did die, but generally a level greater than 30 appears to be protective against getting COVID-19 and dying from COVID-19. We're now going to talk about the post-COVID syndrome. So this is again where it differs from influenza. Patients who have influenza, they recover with really no follow-up symptoms. Remarkably, about 50% of patients who have COVID-19, and this can be mild symptomatic disease, have this post-COVID syndrome. And that significantly impairs the quality of their life. And this can go on for months. The most common symptom is fatigue and tiredness, followed by dyspnea, joint pain, chest pain. So this is a serious disease which causes serious consequences. The long-term consequences, obviously, are unknown. The cause of the post-COVID syndrome is unclear. However, it's important to note that it's not due to active viral replication. As we've said before, the virus is dead. What this may likely be due to is a prolonged host immune response against the dead virus. So the inflammation has not subsided. One has ongoing inflammation, and this probably or possibly drives the syndrome. However, there's been very little research in this area. So what can you do post-discharge for hospital? Firstly, patients are at a very high risk of deep venous thrombosis, pulmonary embolism. So in high-risk patients, you have to consider extended DVT prophylaxis. Then, as we said, this may be due to ongoing inflammation and high levels of cytokines. So one should consider a course of corticosteroids. However, this should be guided by the C-reactive protein, and obviously this should be administered and monitored by the patient's primary care physician. The other things that are important is omega-3 fatty acids and statins, such as atorvastatin. The importance of these both drugs is that they produce a class of fatty acids called resolvins. Resolvins, as the name suggests, are molecules that terminate inflammation and promote healing. So the combination of omega-3 fatty acids and atorvastatin may really help terminate the inflammation and promote healing. Again, we suggest melatonin and multivitamins, but clearly more research needs to be done in this area. We're now going to move on to a really important subject, that of misinformation and social media. It was truly astonishing that the World Health Organization had to put out an announcement that drinking bleach is not a good idea. Clearly, drinking bleach will kill the virus, but it may kill you as well. This is clearly not a good idea. Unfortunately, there are unscrupulous people who are profiting off people's panic. They're profiting from panic. So there are a whole bunch of bizarre, bogus cures and scams in the coronavirus era. So you have to be really cautious, as we'll see. This can be very dangerous. So you really need to think twice before you would consider any of these therapies. And as you'll see, they are bogus. So this is just a short list. There was this ridiculous idea of putting patients with COVID-19 in pressurized aircraft, nebulizing hydrogen peroxide, gargling salt water, steam inhalation, ozone rectal insufflation, rhubarb enemas, ultraviolet blood irradiation. This is kind of interesting. What these people do is they take out your blood, they irradiate it, and then put it back again. So this is ridiculous for a number of reasons. Firstly, SARS-CoV-2 does not infect red cells. As we said before, virus needs a nucleus and ribosomes. Red cells do not have neither. So SARS-CoV-2 cannot replicate in a red cell. So this idea is completely bogus, as are these other ideas of disrupted hemoglobin. The red cells aren't infected. Volcanic ash from the eruption of the Tal volcano, boiled petal leaves, colloidal silver, methylene chloride, oral hypochloric acid, an anti-coronavirus mattress. So apparently this mattress has some kind of magical properties. It emits odors and other unknown factors that kill the virus. They're COVID organic, so a whole lot of influential people are promoting a bunch of really bogus cures. This is a herbal drink based on the Artemisia plant. People, particularly in India, are promoting drinking cow urine and applying cow dung on the body. In the Middle East, camel's urine mixed with milk, honey, and olive oil, electric shock therapy, distance touch healing therapy. So this is just a short list. So people have to be really on the lookout for these bizarre scams. And unfortunately, patients are being harmed and people are profiting from these bogus treatments. The bottom right, you can see a bioenergy platform. This device apparently emits some kind of energy field, and this is supposed to cure COVID. The device is sell for over $1,000. So we now move into the pandemic of social media. So it appears the social media pandemic actually travels faster than the COVID-19 outbreak. This is a quote from Dr. Tedros, director of WHO. Basically, he says misinformation on the coronavirus might be the most contagious thing about it. We can't ignore the enormous anxiety and depression that this virus has had on the public in general. So this is a study from China, the first primary source of this infection. They looked at 4,870 participants. So these were random people in the population who had not been infected. You can see 48.3% had depression, 22% had combined depression and anxiety, 20% had anxiety alone. What they found was that social media exposure doubled the odds of anxiety and depression. This is a study from the US across 2 studies with more than 1,700 adults recruited online. They provide evidence that people share false claims about COVID-19, partly because they simply fail to think sufficiently about whether or not the content is accurate when deciding what to share. So basically what we're saying is that when you come across something which doesn't seem to be particularly correct, check it out. Don't be misled by scammers. And if you're not sure, do not share this bogus information. Again, another slide looking at social media, showing that social media significantly increases the risk of depression and has some effect on health behavior changes. And again, many of these social media posts are not accurate. So, how to cope with anxiety about this virus? So I think it's really important to get your information from reliable sources. You want to use reliable medical sources. Social media is not a reliable source of information. And you want to do this at a designated time in the day. You don't want to be checking sources every hour or every 5 minutes. This results in severe anxiety. And then you want to recognize things that you can control. You want to practice self-care, good sleep, balanced diet, relaxation activities, and most importantly, avoid social media as much as possible, because the false information propagated by social media is truly astonishing. However, in this time, you want to stay connected to positive people. Social isolation can have severe consequences. So you want to stay connected to positive people remotely. You want to have a plan for staying in touch with family and friends, and you want to identify positive influences. You want to limit contact with those who are worriers and are overcome by anxiety. And most importantly, as a community, as a society, we need to maintain a sense of hope, humanity, and kindness towards each other, because only us, humanity, can overcome this disease. And for those people who really have overwhelming anxiety, they should seek professional help. As we said before, the truth is more important now than ever, and the truth has no sides, and it's important to seek out the truth. And finally, we need a game plan. Each of us needs a game plan, but most importantly, our society needs a game plan based on the best available evidence. This should be a dynamic plan, but we need to keep to the plan. We can't keep on changing our ideas. Wear a mask, don't wear a mask. Social distance, don't social distance. I think we need to stick to the science, and we need a plan. And if we do this all together, all of us together, we can overcome this disease. And I thank you for your attention.